20 years, CHAI has been working with the government on a mission to save lives and to reduce the burden of disease in low and middle income countries, including Rwanda, where we work to strengthen the government systems, but also ensure that essential commodities and health services are available to the people at the grassroots level, the citizens of Rwanda. So we've been working with the government of Rwanda on various initiatives, all aimed at saving lives, including viral hepatitis. So the viral hepatitis program started in 2015, a while ago, when we focused on screening for people with hepatitis, viral hepatitis, and providing those that were tested positive with treatment that were needed for hepatitis B and C. I'm glad to report that in Rwanda, to date, over 7 million people have been screened for hepatitis C, and over 60,000 have been treated with very high cure rates of over 95%. So we will continue to work with the government to support various initiatives. Specifically with regards to hepatitis B, we are glad to partner with the Hepatitis Fund to introduce catalytic hepatitis B birth dose to the children of Rwanda. Rwanda has been doing very well with vaccine coverage, with over 100% vaccine coverage, and over 90% of the children that need vaccines have actually received them. Despite this great vaccine coverage and immunization uptake, hepatitis B birth dose has not yet been introduced in the country. So via this grant, CHAI and the government of Rwanda, with support from the Hepatitis Fund and the Canton of Geneva, will be able to train healthcare providers, prepare and print materials, purchase and catalytically implement hepatitis B birth dose vaccine uptake. So we expect to screen over 90% of women attending antenatal care for hepatitis B, and 90% of the eligible patients will be initiated on treatment, and 90% of the newborns that are at risk will be vaccinated within 24 hours. We hope that our strong partnership will help us to successfully implement this program and expect a significant impact. To date, we've already started, and we have done a needs assessment and presented the results to key stakeholders, including government, and we've trained at least 2 health providers in every health facility. That's over 1,000 health providers that have been trained, and we've initiated a project in each of these health facilities. We've also conducted a baseline assessment that shows the current situation in the country, and we'll use the results of a baseline assessment to provide interventions to improve the uptake of hepatitis B birth dose in the country, and generally work towards triple elimination of HIV, hepatitis, and syphilis.
For us, actually, I can say that we are ready, because actually we are committed. There is a political will. This is actually the wish of the Minister of Health. But also, if we look at our vaccination program, so we are ready to host any new vaccine, so without even including other new equipment. For hepatitis B, so we are more than ready, because actually it has been approved by National Immunization Technical Advisory Group to introduce hepatitis B birth dose, but also it is included in our guidelines to prevent this hepatitis B, and most especially to avoid the transmission from mother to child.
Currently, we are happy that now the hepatitis screening has been put in routine services to be provided in antenatal care services for all women, which was not the case in the previous years. Currently, being able to train at least 3 healthcare providers per each health facility, hospitals and health centers countrywide.
Kwipimisha hepatite B cyangwa guhabwa imiti ya hepatite B cyangwa gukingirwa hepatite B n'ubuntu.
Nkuko twabonye amahugurwa yo kurinda hepatite B mu bana birashoboka cyane ko twarinda abana kuvuka bafite iriya ndwara ya hepatite B.
We think that actually have opportunities here because actually we have a very big number of pregnant women who are attending ANC services. So meaning that actually from there, so we can even plan very well. And in addition to this, actually we have a very big number of mothers who are delivering in the health facilities, so assisted delivery. If you look at the coverage, actually it's very high, more than 95%. So we think that actually that is also a good opportunity to ensure that actually this program can be successful.
Mbere na mbere turabanza tubashimire ku mahugurwa meza mwaduhaye yatwunguye ubumenyi. Twaje kubona ko rero nk'ikigo nderabuzima natwe dufite inshingano dushobora kugira icyo twakora kugira ngo turwanye hepatite B. Muri izo nshingano dufite, iya mbere abadamu bose baje batwite tukaba screeninga hepatite B. Icya kabiri, abadamu bose batwite twa screeninze hazavamo abashobora kuba bazaba bafite hepatite B. Abo badamu rero nk'ikigo nderabuzima dufite inshingano zo kubashyira ku miti. Indi nshingano ya gatatu ni ugukingira. Tugomba gukingira abana bose bavutse ku bagore batwite bafite ubwandu bwa hepatite B.
We need to even to introduce this hepatitis B vaccine in our settings, but also there is a need to do capacity building of healthcare providers so that they can even be able to link those women who test positive in either in antenatal care or during delivery to PMTCT services related to hepatitis B. But also we need to avail some tools like some job aids which also can orient healthcare providers who will be working in services like antenatal care, maternity and so on. Of course there is also a need to do awareness.
Ibikoresho, imiti, inkingo twifuza ko rero byaboneka kandi kabonera ku gihe, tukirinda ko habura ibyo bikoresho n'abaje bagana service yacu bakabura service.
And I have to say that also when you see vaccination program here in Rwanda, so actually it is improving a lot. So now we are becoming fully digitalized, so meaning that actually we need beyond vaccination even IT equipment and also trainings and also space. So we think that actually it is something we can still continue to discuss with all our stakeholders, because actually there is a number of areas in which really stakeholders can support.
Imbogamizi ntekereza ishobora kubaho ni uko hari nk'ababyeyi bashobora kutitabira kuza gusaba serivisi nk'ababyeyi batwite kwa muganga, ngo bityo niba afite ya ndwara tumubone hakiri kare, tumukurikirane, tumutangize imiti, ndetse n'umwana navuka azahabwe rwa rukingo rumurinda kwandura iriya ndwara.
So for us, actually, I can say that the most barrier is actually the cost of the vaccine. So to ensure that actually we can sustain this hepatitis B birth dose, ensure that actually we can avail vaccine to all babies. So actually, that is where I can say that actually I see that as a challenge.
Yego, ndahamya neza ko iyi gahunda twihaye yo kurandura hepatite B mu bana izagerwaho. Icyo nshingiraho mvuga ko izagerwaho ni uko nyuma yo guhabwa amahugurwa habayeho kwigisha bagenzi banjye bandi kugira ngo twese tubigireho ubumenyi. Ndumva ari icyo ngicyo nshingiraho, mpamya ko iyi serivisi tuzayigeraho.
Abakozi bacu bafite ubumenyi buhagije kandi baracyanabuhabwa. Abo bakozi bacu nkabona bazadufasha mu kugera ku ntego yacu twihaye yo kurandura hepatite B.
In our settings, elimination of hepatitis B is achievable, even based on the other diseases which are preventable through vaccines. We achieved this goal of eliminating them. This also shows us that it is also possible to achieve the elimination of hepatitis B.
Just to thank all our stakeholders, including CHAI, so we can even start targeting those children who are at high risk. But definitely we are also advocating to Gavi, Global Alliance for Vaccine and Immunization, to see how they can support so that we can vaccinate all babies. So we think that actually it will be successful.